For this video, I wanted to demonstrate the 3 locations for intramuscular injections using myself as a diagram. First, I would begin by finding my deltoid, which I would begin at the top of the shoulder and working my way down 2 to 3 finger breadths, or about 1 to 2 inches, and injecting right there into that deltoid muscle that sticks out. Secondly, I would begin by my ventrogluteal. That is found by placing the palm of my hand on the greater trochanter bone of my patient and allowing my thumb to point up towards their abdomen and my index finger to be pointing towards their anterior superior iliac spine, and my last 3 fingers pointing towards my iliac crest. And in this V right here is where that injection would go. And lastly is going to be my vastus lateralis. I would begin by splitting my leg into half, and knowing that the external side of the thigh is where the injection would go, I would find the top of the knee 1 palm width up, and from the hip 1 palm width down, and inject into the external side of that thigh, and that would go for both external sides. Thank you. Okay, I'll be doing an intramuscular injection. So, Mr. Johnson has received an order from Dr. Smith to receive Lasix 40 milligrams per 1 ml, administering 1 milliliter intramuscularly stat. So I will compare the physician's order with his MAR, and it reads Lasix 40 milligrams, so we have the right drug, right route, right dose, right time, and of course the right patient. So I will go ahead and prepare his medications, and performing hand hygiene and donning new gloves. I'll take a clean alcohol swab and clean the top of the vial while I prepare his syringe and needle. I will pull back 1 milliliter of air, and making sure that this is the right medication. It is Lasix 40 per 1 ml. I will inject 1 ml of air into the vial, pulling back for 1 milliliter. Making sure that there is no air bubbles, I will scoop and recap the needle safely. There is no air bubbles, and I will replace with a clean needle at this time. And I'm going to label his syringe because I'm preparing this outside of his bedroom, outside of his patient's room, taking off my gloves and performing hand hygiene. So let's go see Mr. Johnson and administer this injection. Hi, Mr. Johnson. My name is Colton. Dr. Smith has given us an order to administer an intramuscular injection of Lasix 40 milligrams to you. Can you verify your name and date of birth for me? Correct. Okay, so I'm performing my 3rd and final check of medications against my patient's MAR and what he told me. This is the right patient's name, right medication and dose, and I will get a clean pair of gloves after I sanitize my hands 1 more time and put the gloves on. Alright, Mr. Johnson, this injection is going to go into your hip, in your ventrogluteal. I'm going to have you roll to your side and landmarking. I'm going to place my palm of my hand on his greater trochanter of his hip with my 3 fingers facing towards his back and my index finger pointing towards the anterior superior iliac spine and my thumb pointing up towards his abdomen. I will take a clean alcohol swab and circular motion clean and allow that to air dry. And while that is, I have my location marked, and I will uncap my syringe, gently pull the skin taut to create a Z-track method, insert the needle at a 90-degree angle, pull back just a little to make sure I do not receive any blood flow, and slowly inject the solution into the patient. Waiting for 10 seconds and withdrawing my needle and placing into a biohazard sharps container. I'll place my alcohol swab on top of the site just for a moment. And at this point I would apply a Band-Aid if needed, but it does not look like it is needed at this time. I will take my gloves off, perform hand hygiene once again, document my site, and then I'm done. Thank you.